Hong Kong reported more than 4,000 new local COVID infections for the second day in a row. More than 180 cases were imported. There were 6 further COVID-related deaths. As to whether the daily tally could encroach the 5-digit territory if Omicron subvariants take hold, Hong Kong's health experts offered differing views. Jackie Lin reports.
The outbreak in the Department of Rehabilitation at Kowloon Hospital continues to unfold. 2 more patients tested positive for the coronavirus, bringing the total number of linked cases there to 9. The cluster at Two Moon Hospital also grew after 3 more patients and 4 more workers contracted COVID. There's also another infection cluster stemming from a retirement banquet by Cathay Pacific staff on July 5th. Responding to media inquiries, Cathay says a worker tested COVID positive 3 days after attending the private gathering. Over the next few days, several other attendees also came down with the virus. Cathay says internal investigations show all staff who participated in the event followed social distancing guidelines. To prevent the public health system from being swamped by the 1,000-strong infections every day, the hospital authority activated Phase 2 of the contingency response mechanism. This will beef up the number of hospital beds for COVID patients to 2,500, with more manpower diverted to care for these patients.
The service adjustment will be mainly on the non-emergency service, namely the elective surgery, but we still try to keep our service as much as possible.
There are currently more than 1,700 inpatients in the city's public hospitals. Over 1,250 of them are COVID patients. On a radio show, respiratory medicine expert Dr. Leung Chi-Chu warns, should the more transmissible subvariants BA4, 5, or BA2.2 become more prevalent, the city's daily COVID tally could reach a 5-digit level in 5 to 10 weeks, citing the pandemic experience in Singapore. Another top epidemiologist, Professor Benjamin Kelling, struck a more moderate tone on the prediction.
Infections have been rising relatively slowly, doubling only every 10 days, with much less stringent control measures in place than in the 5th wave. So the reason for the much slower growth this time round must be a high level of immunity in the population.
Professor Kelling predicts the infection wave will peak in early August. Jackie Lin, TVB News.